it started? Yeah, recording started now. Thank you.
Okay, good afternoon, everybody. Welcome to the meeting of the Executive Cabinet Member for Adults' Health and Wellbeing, which is me. We have a 5-item agenda today to consider. We don't normally note apologies, although I'm going to invite Susan to tell us if anybody has apologised, even though they don't have to.
I think Rachel Tanner has apologised, but Christian's going to step in on her behalf, and I've not heard of anybody else. Lynn's here instead of, I think, Lisa. So yeah, I think that's it at the moment. Thank you.
All right. Okay. Thanks, Susan. So if there's nothing further, then we can move into the agenda. Item 1 is the monitoring of Executive Cabinet member decisions. That report has been circulated, and we just take it as read, if I've understood that correctly.
Yeah, I think if anyone's got any comments or questions on it, they can ask them. But I think it's pretty much up to date as far as we can at the moment. But if you just want to invite questions from anybody, if they've got any comments or questions on it.
I didn't spot anything that I wanted amending. Anybody else, please indicate in the usual way. Nope. Okay, fine. So that can be recorded as noted.
Yeah.
Adults Performance Monitoring Report Q4, again, report enclosed for consideration. Do we have anybody speaking to this report? Take it as read or?
I think somebody normally speaks to it, but it is an adults one, so I'm not sure if anyone's. Is it you, Christian? No. I think it's just. I think it is just for noting. To be honest, it's like it is quite comprehensive, and it's just for noting, really, just to keep you abreast of what's gone on. But of course, people can ask questions if they've got any.
Of course, yeah. I mean, I read it ahead of the meeting, and I'm happy to note it as it is. However, any of the other members present wish to comment or ask a question? No. All right. So that can be recorded as noted. Thank you very much. Right, so there will be some discussion on the next 3. Item 3, enhancement of local stop smoking services aligned to additional government tobacco grant. So we've got a bit of extra money and we need to decide today how to spend it. Is it Suzanne? Is this you?
It is, yes. Thanks, Chair. Okay. So we've, as you say, we've received some additional monies from the Office of Health Inequalities and Disparities. It's a specific grant to enhance our local stop smoking services and support. We've got a new service within Bolton provided by ABL. So really this grant will enhance that local service offer, and there's several other elements it will provide funding for as well, which are outlined in the paper. The report outlines the commissioning and procurement, which will involve using the provider selection regime, most suitable provider process. And in summary, as I say, it's the report makes a series of several recommendations, which include approving the direct award for the delivery of stop smoking services using the PSR, most suitable provider process, the approval for communications plan and contingency budget, and to work us through the process, delegating the approval to Director of Public Health, i.e. Lynn, to enter into the contractual arrangements outlined in the paper, working through the statutory guidance. So happy to take any questions from anybody.
Okay, thanks, Suzanne. And there's been some press coverage on this already ahead of this meeting taking place, because the papers have read journalists have read the papers and written a story about particularly picking out the cost of tobacco harm to the public sector in Bolton, which is not insignificant. So it was £95 million that is being spent on managing tobacco harm that could otherwise be spent on other preventative public services or other public services in general. So absolutely welcome that we've got some more money to invest in spending on helping more people to stop smoking, and I hope that there'll be some further coverage after this that will promote the services that are being beefed up with this extra money. I just want to say thank you to the officers, because I know that it's a huge amount of work trying to work out where best to spend this unexpected, well, not unexpected, but award that wasn't, well, it was unexpected, I guess, wasn't it? And particularly the work that you've done to reduce the amount that we spend on internal recharges and comms, because we want to be spending this on as much as possible on providing a service to help people, not just on paying staff salaries in the town hall. So thank you very much for the work that you've done on that. Do any other members wish to comment or ask a question of officers? Councillor Walsh?
Yeah, just a comment, Chairman, to say that I concur entirely that we need to spend money on the front line and getting the message across directly. I think that's hugely important. Can I just ask how we tie this in with enforcement action against premises shops that are selling illegally, often to underage smokers, and seeking to try and tie two strategies in together and have a properly integrated arrangement?
Thanks, Councillor Walsh. Lynn, I guess your hand is because you wish to respond to that.
Yeah, I'm happy to respond in that we do work really closely with our colleagues in the Place Directorate and the Regulatory Services team, and have done a number of enforcement actions over the last sort of year, particularly, and that's around illicit tobacco and illicit vape activity. So that includes the sales of illicit products, but also underage sales as well. So yeah, we work very closely with our colleagues in our Place Directorate here in the authority.
Thanks, Lynn. Councillor Walsh, do you wish to come back on that? Sorry,
just to say thank you. That's perfect.
Thanks, Councillor Walsh. I think you broke up towards the end there, but we heard the thank you, so thank you very much for that. Councillor Williamson.
Yeah, it was pretty much along the similar lines as Councillor Walsh. It was regarding the current vape increased sales, and I know I know we're talking about the tobacco, but has there been a line put in regarding the illegal sale of the vapes and how they're going to be monitored, assuming that that will be the next big drain on the NHS, the resources of that, noticing the fact that we've now got 11-year-old vapers versus 14-year-old smokers, it was harder to get. I just wondered if there's a contingency plan for that.
Lynn or Suzanne?
Do you want me to come in on that, Lynn? I can start off. Yeah, we commission Bolton NHS Foundation Trust to provide our adolescent service through 360. So they go into schools, providing advice and guidance to pupils and to school settings around vaping, the harms of vaping, and really offering that specialist support to young people. Does that help? Lynn, I don't know if you want to add anything.
Yeah, I mean, absolutely. We do have that adolescent service that is there offering that support and that guidance. And I think more broadly, we are trying to make sure that we have a good comprehensive programme of comms and activity that is producing and pushing out the right messages. Firstly about the dangers and the harms, but also about where people can get support.
Thanks, Lynn. Councillor Williamson, do you wish to come back?
No, thank you for that. No. Thanks.
Okay. Thank you. So, I mean, we do have a good stop smoking service here in Bolton. One of the questions that I asked early on when I was appointed here was how effective is it in more deprived areas, because we know that prevalence of smoking is higher in more deprived areas, and those are also the areas where people are least likely to reach out and try and access these support services. And when the data came back, it showed that we are very effective at reaching our more deprived communities and helping them to stop smoking. So that's very positive, and hopefully this additional money in the way that we're going to agree to spend it today will continue that great work. So if there's nothing further, I am happy to approve the recommendations as set out at the front of the report. And I hope that's the correct wording for that to be a decision, yeah. Susan. Yeah.
Yes, it is. That's fine. As long as you've approved all the recommendations, that's fine. Thank you.
Thank you. Thanks, Suzanne. And thanks, Lynn, for responding to the questions. So moving on, we're now on to the development of an all-age flexible purchasing system. Christian, over to you.
Thank you, Councillor Fielding and members. So I did sort of say at the start, I felt like we've slightly over-egged this report a little bit, because really what the report about is the recommendation is about the agreement, getting agreement to form this flexible purchasing system for services that that were previously or have previously or historically been funded by a grant in the voluntary community sector. So the idea here is that this framework will enable us to commission better, be able to work closer with the voluntary community sector and achieve better outcomes for people in Bolton. So the recommendations there, I think you can see. I think what's really encouraging about this piece of work is that we have done this in a co-produced way with the voluntary community sector as well. So they've been very much connected to this, and it will be the means for us to call off to commission any services or procure any services going forward. If people have any questions, happy to answer them, but just mindful that really this isn't about us commissioning anything. This report is simply putting the vehicle or the framework in place for us to commission from. And of course, there's opportunities to have longer contracts. I think it will help the voluntary community sector to deliver better going forward, and then to be far more connected to the work that's happening in terms of commissioning these services going forward.
Thanks, Christian. So yeah, it's a model of commissioning. It's one of those kind of dry things, but we have to do it so that we can enable the voluntary and community sector to access things that we want to pay somebody else to provide on our behalf. So I think that with a new system that organisations are not familiar with, there's always that challenge of whether they will be confident enough in accessing it and know how to navigate it, and particularly the smaller organisations. And I'm pleased that there's a nod in the report to that, which shows that there will be support for smaller VCSE organisations to help them understand the system and make sure that they don't miss out on opportunities that they may be very, very well suited for. So I'm very comfortable with the recommendations as they're set out and the proposals to develop this system. But I will open it up to colleagues on the call if there are any questions or comments. No, I don't see any hands. Fine. So with that, thanks very much, Christian.
Thank you, Councillor Fielding.
And Susan, I'm happy to agree the recommendations as set out in the report.
Thank you. Thank you.
All right, fab. So final one is commissioning of a joint integrated substance misuse prevention, treatment and recovery service for Bolton, Salford and Trafford. Who's doing this? Lynn?
I think it's Lynn, yeah.
Thanks, Councillor Fielding. So this paper is regarding our adult drug and alcohol services, which are a responsibility of the local authority to commission within the local system. And we are currently have an arrangement jointly with Salford and Trafford to commission this jointly across our patch. We commission an integrated treatment and recovery provision from Greater Manchester Mental Health NHS Foundation Trust, and they deliver through their specialist addictions division and their Achieve partnership. And that, as I said, reaches across the three boroughs of Bolton, Salford and Trafford. Salford currently act as our local authority lead commissioner on that arrangement. And this paper asks for approval to continue with a very similar set of commissioning arrangements, whereby we enter into a new contract via Salford as the lead commissioner, with Greater Manchester Mental Health as the provider via a PSR arrangement, that's provider services regulation arrangement. We also are building in some contingency arrangements where if for some reason we're not able to reach an agreement or meet the conditions of PSR, that would proceed to a full tender. And similarly, we're mindful in terms of timescales, and if that particular agreement cannot be reached, again, within the appropriate framework, we've also included a contingency for Bolton to make its own arrangements. So that there is more detail in the paper which sort of sets out some of the rationale and some of the arrangements. But very broadly speaking, we're asking for the permission to secure those arrangements so that we can secure a new contract for that delivery going forward from next year. So happy to answer any questions. I know you've all had sight of the report in advance. Happy to try and answer any questions.
Thanks, Lynn. Well, my immediate reaction when we look to commission something jointly with other authorities is to consider whether doing that dilutes Bolton's ability to get what it needs, because there are resources that are going to elsewhere as well. Through the discussions that we've had and the way the paper's presented, I'm confident that that's not the case, particularly when this is an arrangement that has existed for a while already. But equally, if we can't get it over the line jointly with Salford and Trafford, the contingency to go it alone and the preparation that's been done for that just in case, although I hope it doesn't come to that, again, is reassuring. So, yeah, thank you for the work that you've done on this. And I'll open it up to colleagues if there are any questions or comments that opposition members wish to make. No.
Okay. Fielding, I've just got a question on the actual recommendations. I know there's an R in there, Lynn, under recommendation number 2. It says A or B. I'm assuming that if Councillor Fielding wants to continue with the current arrangements to direct towards C, then we'll take out the B bit, or have I got that wrong? You're on mute, Lynn.
Yeah.
Sorry. Yeah, we want to make sure that we've got provision in there for 3 different scenarios. One is our preferred scenario, which would be direct towards C under the PSR arrangements. Our second as part of the tripartite arrangement with Salford leading. Our contingency for that is to direct to go to a full procurement with Salford as the lead on behalf of the tripartite. Right. And then our final contingency is for Bolton to go alone.
Yeah. So that R is left in because if C doesn't work, then we'll go to the B bit. Yeah. Okay. I just wanted to double check.
Make sure we've got all those options available.
Yeah, you've covered every single eventuality. Yeah, I understand that. Okay, so that's correct in the minutes. I'm just double checking. I'll send them over to you anyway, just to double check. But yeah, I understand now. Thank you. And that's preempting what Councillor Fielding's going to agree now, but
yeah, no, it's okay. It's okay. That's why you're here. Right. So there was nobody else that wished to speak on this, and I'm content with the recommendations and to accept them as, or to agree them as detailed on the front of the report.
Yeah. Okay.
Recorded. Great. So that was the final item. Thank you everybody for your attendance. See you all again in a few weeks.
Okay, thank you very much. Thank you. Bye-bye.
Thanks, everyone.
Thank you.